Hello, I'm Michael Shuler with Athens Orthopedic Clinic. Today we're going to talk a little bit about de Quervain's. It's a tendonitis of some tendons that pull your thumb up. It typically hurts in the radial aspect of the thumb. It's called new mother's disease, typically because mothers are picking up their babies like that. It's typically associated with an overuse of the tendons that pull the thumb up and out. It's called de Quervain's. Sounds like a tequila. It's not nearly as much fun. It does hurt and can really cause a lot of problems for people. So what's going on in de Quervain's is you have two tendons that run like this, that run right over the top of this bone called your radius. They pull the thumb up and out. They run through a little tunnel right here, and typically that tunnel gets tight, and when it gets tight it squeezes on those two tendons and really causes a lot of pain. Typically people that have a lot of problems with this have an extra little tunnel inside the main tunnel. So treatments for de Quervain's, assuming that's what you've been diagnosed with, there's multiple things that can be tried. Conservative managements include stretching, especially performing this activity, which you'll typically find hurts initially. Splinting can be tried, corticosteroid injections, anti-inflammatories, all of which may or may not help. Again, if you are predisposed to this with an extra small tunnel inside the larger tunnel, these things typically won't work. If non-surgical options don't end up working, then we talk about surgery. If we do surgery, it's about a 5-minute surgery. Typically it's under general anesthesia. It's a small incision right along the base of the thumb where we release that those tendons in that sheath. Assuming we do that, you're placed in a splint for approximately 3 days. You take the splint off at home, and I want you to start to work on range of motion activities really as soon as you're comfortable. So again, surgery typically takes about 5 minutes to do. It is typically done under general anesthesia, but can be done under a local of some type. It's done in an operating room. Stitches are placed underneath the skin, so typically sutures do not need to be removed. Local anesthesia provides about 24 hours worth of pain relief afterwards. You are placed in a splint that is to stay on for approximately 3 days. That splint is to try and prevent those tendons from flipping over to the volar side of the wrist. And you'll take the splint off at home, start to use the hand as much as you can or as normal as possible. There might be some swelling and soreness as you start to do more activities. That's not uncommon. Typically most people are really quite relieved after the surgery due to the preoperative pain. You may have some funny feelings on the back of the thumb and back of the index finger. There is a nerve called the radial sensory nerve that we move out of the way during surgery that can get irritated. If this is occurring, really the best thing to do is rub any area that feels strange or pins and needles, and that should ultimately resolve over the next couple days to week. So hopefully you've learned a little bit about de Quervain's. If there's any additional questions, please feel free to ask.